Welcome to my channel. This is Bruce the Boss, and today's topic is the irreversible effect that lockdowns may have had on our children, which this is the time to stand up before it's too late. By the way, if you're not yet subscribed to my channel, go ahead and smash on that subscribe button, like this video, comment on this video. Your subscriptions go a long way with allowing me to produce and or make more content. Now, with that said, let's roll the clip.
I get to underreported stories as well. Jan?
For me, my kids hear me rant about this every day, so I may as well tell you guys. It's the crushing impact that our COVID policies have had on young kids and children. By far, the least serious risk of serious illness. But even teenagers, a healthy teenager has a 1 in a million chance of getting and dying from COVID, which is way lower than dying in a car wreck on a road trip. But they have suffered and sacrificed the most, especially kids in underrepresented, at-risk communities. And now we have the Surgeon General saying there's a mental health crisis among our kids. The risk of suicide attempts among girls now up 51% this year. Black kids nearly twice as likely as white kids to die by suicide. School closures, lockdowns, cancellation of sports. You couldn't even go on a playground in the DC area without cops scurrying, shooing the kids off. Tremendous negative impact on kids, and it's been an afterthought. Yeah. It's hurt their dreams, their future, learning loss, risk of abuse, their mental health. And now with our knowledge, our vaccines, if our policies don't reflect a more measured and reasonable approach for our children, they will be paying for our generation's decisions the rest of their lives. And that, to me, is the greatest underreported story of the past year.
So you heard them say it, and this, I feel as though we could have called this from the very beginning of this. Again, the damage may have been very much irreversible that has been had on the current generation, many Zoomers and our current youth. It's really sad for me to have seen recently a tweet, I believe about a week ago, of a poor mother talking about how her 6-year-old child has no recollection whatsoever, no memories of going to one of their childhood one of their friends' birthday parties, something you would think is a practically normal tradition and or practice amongst most people in this country, at the very least, of being able to be around other kids that you care about and having a birthday party and enjoying yourself. Not so recently. We're seeing spikes in suicide, depression, just a bunch of mental disorders due to the lockdowns on a population that has, or should I say, a demographic that was in no way at risk and or in any harm of the Modella virus, to borrow a phrase from aka Eric July. As you heard them say, the deaths among youth are statistically zero, like a 1 in a million chance. And if you ever hear any stories or incidents of any severe related adverse reactions to the virus by youth, it's usually almost 90-95% massively obese and or otherwise asthmatic youth, not your everyday run-of-the-mill child. In fact, all studies and or statistics have shown that suicides vastly outnumbered deaths by the virus. So this is a population that can take this particular virus, unlike the flu, and not have nearly as many severe reactions, hospitalizations, and or deaths whatsoever. Again, but we're calling a national alarm on mental health and or suicide watch among these youth. Why? Because they've been isolated. They've been asked to bear the burden for a virus that does not affect them for other individuals, as opposed to just taking measures to protect those who are at risk, as opposed to doing a one-size-fits-all. We isolated them from friends, family members, loved ones. You can't do that to an individual. That's why when you're in jail or in prison and you're sent to the hole as the ultimate punishment, because no one's meant to be in isolation. It's not psychologically good. It's one thing if you are going for a spiritual awakening, but forced isolation from others is some of the worst torture you can do to an individual. You're keeping them away from friends, family, loved ones. They can't go on dates, their first date, second dates, things like that. They can't interact and learn and have those social connections that they would otherwise have. They can't go to school. The learning has definitely been suffered, and many youths around this country have probably actually been set back a whole year because distance learning is in no way equal to that of face-to-face, especially with a lot of hands-on and or kinesthetic learners, and or for those teachers who are out there who are able to identify those who are struggling there in person, unable to do so in a more distant learning. The distraction level is much higher at home. So this has been as if many of the public education in this country was ever that adequate to begin with, given the high level of barely proficient individuals across the board in this country. But that's another topic for another day. By isolating them in their homes, you're forcing them into situations where they may be at risk of greater abuse. Getting out of the house to go to school, to hang out with friends was a source of refuge for those kids. To get free meals while at school, also taken away. Again, why? Because we wanted to protect grandma, grandpa, things like that, when you could have done measures to do that. We're at the point now where grandma and grandpa, if they wanted to take the jab, as if it was going to really make any world of difference, especially depending on their own health situation, and if they spent decades upon decades building up a bad immune system, obesity, high levels of blood pressure, hypertension, high cholesterol, then the jab really isn't going to do that much for grandma and grandpa to begin with. But that's, again, another issue for another day. There are measures we can take, especially now, to ensure that that doesn't happen if that's what you want to make the argument. And then I always point to Sweden. Always Sweden from the very beginning of the pandemic, in which case Sweden never did the hard lockdowns that almost every other country did around the world. There was no mass mandates. They kept the businesses open, the stores, parks, gyms, restaurants, and yes, schools. If you had walked around Sweden back in the summer of 2020 during the height of it all, you wouldn't have seen any difference whatsoever amongst the people in that area. But again, they kept the schools open, and we did not see this any massive issue affecting not just the kids, but the teachers as well. Nothing out of the ordinary occurred. And again, if teachers wanted to protect themselves, there are means to do that as well. Not just getting healthy, obviously, is the first thing. Eating right, exercise, so long as you're young. But if you, again, want to take the jab, if you feel as though that will help you, teachers can do that. No need to apply any additional restrictions necessarily. And then we're also seeing the rise or the spread of said virus, regardless of whether or not individuals are jabbed. Why are we forcing an experimental medication on individuals who, again, statistically have no risk? And yet you're also seeing rising cases of myocarditis and pericarditis in young individuals who can still easily spread it. No different than really whether or not they had the jab or not had the jab. Again, you can say that it's reduced, but according to the Lancet study, that reduction isn't much more than 10-12%. So if you're talking about out of 1,000 individuals, you're talking about the difference between 900 or 887 people versus 1,000. Compared to 1,000, that's not the biggest gap or differential in the world to force, again, an otherwise experimental medication on youth. Just the trauma. If this doesn't get you motivated, if you don't really care that much about yourself and or your own job and or what you see going on around you, whether it's the COVID camps in Australia, what's going on in Europe, and the destruction of the Nuremberg Code. If you're not concerned about the mandates that are forcing people out of work or making them choose between a career and paycheck versus forcing an experimental medication into their body, if you're okay with all that, or you don't care, if it doesn't feel as though that really bothers you, this has to be your tipping point. You have to care about the future generations and do something different. We have to change course. It is inexcusable at this point, knowing everything we know as it pertains to the low level risk that it has on the youth, and now especially with this Omicron variant going around, which already, no matter who you are, your age and or jab status, seems to be nothing more than a mild cold at best as it stands right now. So it seems to be decreasing in severity anyway towards the general population, not to mention kids. Something has to be done to save the kids, because to quote Whitney Houston, children are the future. That's my video. Let me know what you think in the comment section below. Like this video, share this video, comment on this video, and don't forget to sub to my channel. This is Bruce the Boss. Happy holidays, Merry Christmas, Happy Festivus, Happy Kwanzaa. See you in the new year. I'm out.